Just listen. I don't care how high your board score was, but they don't teach this in your dental school. This is the toughest case you've ever had, and she's in her stage 4.
I know how it's done. I've watched a case like this.
I'm serious. This is a life and death decision. She should be handled very carefully.
Primum non nocere. First, do no harm. One of our primary obligations is to do good and do no harm. Dentists holds a particular trust in society, aiming to use their skills and knowledge to maintain the dental health of their patients. They commit to serving the community beyond sectional or personal affairs by providing high quality and timely treatment while considering the patient's needs, desires, and values.
Doc, we have a 36-year-old patient and with her is her dentist. According to the previous dentist, 2 osteotomies were performed in the lower right molars. And during the placement of the second implant, the implant sagged and disappeared into both, causing the increase in bleeding. The surgical procedure was terminated and referred here.
I was hoping sometime this morning that we could discuss what is most important in your procedure and the underlying conditions and treatment we could opt for.
But what could happen when the line between health, profession, and harm is not clear? The 2 main goals involved are the ability to discern right from wrong and the commitment to act on a decision. This will serve as a point of reminder that dentists should neither overestimate the capacity to heal nor underestimate the capacity to cause harm.
You know as well as I do, she needs this procedure.
Then why didn't you change the billing codes?
Because her insurance will cover it.
Dr. Arthur said that yesterday she had a patient, and that patient is a known artist in a channel. She couldn't believe that Miss Soberano is undergoing aesthetic rehabilitation with dental implants. And it was way worse than you can imagine. And I know for a fact that.
Enough. Did you get consent from the patient to talk about this?
No surgery, just get her off the drugs right now!
No, don't listen to her. Can you at least help her ease the pain? Come on, do something.
Doc! Aray, Doc! Now do something! Don't just stand there, but don't operate on her!
No, you need to understand that displacement of a dental implant in the body of the mandible is a severe but rare complication. Her life's in my hands and I need both of your decisions.
What should you decide to do in difficult situations? What will you choose and how will you stand behind your decision? There is a fine line between ensuring that patients receive the care they need and not forcing them to receive the care they don't wish to acquire.
I'm letting you know that, unfortunately, in a clinical practice, all specific risk factors that may develop during the surgical stage are sometimes overlooked, such as local conditions that have unfavorable effect during the surgical stage, increasing the risk of complications or unsuccessful implantation.
You don't need to disclose such information to me without letting your patient decide whether you tell me or tell other people about her condition and other information which is not necessary. I'm just letting you know that this isn't right. The last time I checked, when a patient shows up here in need of treatment, he or she is entitled
But if
to
you
it.
keep grabbing them like this, the insurance company will bury you.
To treat the patient with respect and ask the patient have the right to give consent. To be of service to others while reminding that this will be in better fulfillment with the responsibility to the society to treat people with fairness and honesty. Each of us will make a solemn pledge to be the best version of ourselves in accordance with every law and regulations that we have learned and will continue to learn.
Embracing the highest level of professionalism, to do no harm and to always do good.